Take one. Hello, Isabella. My name is Julie Krueger, and I'll be your provider this morning. I go by pronouns she, hers, her, and I'm just happy that you're here this morning. So tell me a little bit about yourself. What brings you here today?
Normal checkup.
Okay. Just with the normal physical and mental checkup here, we are just going to go through some different chunks of history. So the first thing I want to talk about is your past medical history. So do you remember any childhood illnesses that you might have had?
I had strep throat a few times. I had the flu. I don't know if it counts as an illness. I had really bad cramps, like period cramps.
Okay.
I think that's it for childhood stuff.
Okay. Did you have any surgeries?
Yeah, I had a laparoscopy to see if I had endometriosis, and I did not have it. I had my wisdom teeth removed. I had this frenulum procedure from the roof of my mouth because I had the gap in my teeth.
Okay.
I had my cavities filled when I was a kid, and they put me under. I don't know if that counts as a.
Sure. Yeah, that's definitely a medical procedure. So you had to have some teeth removed when you were a child, and they had to put you under anesthesia for that?
I think they put caps on.
Oh, okay. So, some dental work, a little extensive maybe, dental work. Okay, good. Do you have any adult illnesses that you're currently experiencing or that you've had in the past?
I had COVID. I had COVID last summer. I've had the flu. I don't think I've had strep throat as an adult. I've had colds.
Okay. Let's talk a little bit about COVID. How did that impact you? Was it serious? Was it?
I didn't have to be like hospitalized, but it took me out for like 2 weeks.
Okay.
It sucked, but like I was fine and I recovered.
Okay.
And I don't have any, as far as I know, effects, like lingering effects from it.
Okay, good. Do you have any history of any trauma in your life as an adult or as a child?
I don't think so. The only thing, I don't know if it counts as trauma because I don't think it's affecting me that much, but like when I got my wisdom teeth removed, they were really mean to me, I felt. And they knew I had anxiety, but they wouldn't, instead of asking me what was going on, they would just get angry at me. Like I was having anxiety attacks when they were putting me under, and they were like mad at me for it. So that I just felt really scared. And then I have leg weakness, and I woke up from the surgery, and then they were like, you need to go. And then I said, I can't walk, and they didn't believe me. So then they got you, and then they acted totally different when you were there.
Okay.
But that's the most traumatic event,
Okay.
I think.
Okay, so that was from some anxiety that you had, so we'll get into that a little later when we get into the overall health assessment. Let's go back to just general health maintenance. Do you do any yearly exams? Do you do like breast exams? Do you do mammograms? Do you get checked for cervical exams, pap smears? Do you do any other health maintenance tests?
Well, okay, so I do a yearly checkup usually, and then they always test me for STDs, STIs,
Okay.
and then they do my blood work, and they do like vitamins, hemoglobin, iron levels, high blood pressure. Yeah.
Okay, any issues with any of those?
No.
Okay, those are all normal for you then, good. Okay, do you do any exercise to maintain your health? Can you tell me a little about that?
So when I'm like at my best mentally and everything, I exercise like 3 times a week or more, and I really like climbing, mountain biking, hiking, fishing, kayaking. I really like being outside. I like snowboarding. Yeah.
Okay, so you're pretty active, it sounds like. No injuries from any of those activities.
No.
Good. Okay. Next section, we're gonna go into our allergies. So I just want you to tell me if you have any medication allergies, any environmental allergies like pollens or dusts, or if you have any kind of food allergies.
Absolutely nothing.
You have absolutely no allergies? Okay.
If I inhale a bunch of dust, I sneeze, but that's like, I think that's
Sure.
standard.
Sure. Okay, let's go through your medication history. So can you go ahead and tell me the types of medication you're on right now?
Yeah.
Okay.
Okay, so right now I'm on lithium, 600 milligrams once a day at night. I'm on clonidine once a day at night, 0.01 milligrams. And then I'm on Wellbutrin.
How often do you take the clonidine?
Every night.
Every night, okay.
Yeah.
And then Wellbutrin?
And I'm on the Wellbutrin, and I think it's 30 milligrams. I can't remember, but I think that was 30 milligrams every morning.
Okay.
And then I'm also on hormonal birth control.
Okay. Do you remember the name of that?
I think it's Vierna or something like that. And it's, if I remember right, it's like the lowest dose you can be on.
Okay. Okay. What are the reasons that you are taking the lithium, the clonidine, the Wellbutrin?
So I'm taking it for depression and anxiety,
Okay.
and for also suicidal ideation and self-harm ideation.
Self-harm. Okay. Do you feel that those medications have been working for you?
Mm-hmm. Yeah. First time in my life, my meds actually work, and I'm really happy. And it's been about 2 months since I've gotten on this routine with
Okay.
these meds, and yeah.
Okay.
So it's very new to be like content on my meds.
Okay. Do you have any side effects or any concerns about these medications that you're taking?
No, when I first started taking them, like with the lithium, I was really thirsty, and then that went away.
Okay.
And then with the clonidine, I would get kind of dizzy in the morning, but that's pretty much gone away too.
Okay.
Oh, but the Wellbutrin, we tried to up it one time, and then when we upped it, I started hearing things that weren't there more frequently than normal, like a lot more often. So we decreased it, and then now it's like much less.
Okay. Okay, good. All right. Do you have any creams or ointments that you're using? Any kind of ear medications? Any inhalers?
Nope.
Do you do any herbal supplements? Any vitamins?
Sometimes I take vitamin D. I usually take it every morning. That's what I intend to do, but I forget sometimes.
Okay. And are you current on your immunizations?
Yeah, I am.
Okay.
There's one other one I have to get, like some kind of tetanus shot or something this summer, but she said I could wait till the summer. So.
Tetanus is the only one. Okay. Now we're going to go into your family history a little bit. Can you tell me any illnesses that your direct siblings have or have been diagnosed with?
Both my brothers have had asthma.
Okay.
I think that's like it, unless you count like my sister has problems with her knees, so she's been to physical therapy for that. I think that's it.
Any mental health issues with any of your siblings?
My sister had like she had to go to trauma therapy, but then her therapist said that she is like good, like there's no signs of trauma, so she's not going anymore. I don't know if that's like a hereditary thing or not, but yeah.
Okay, okay. And then how about your parents? What kind of health history do your parents have? Are they in good health or do they have some history with their health?
Yeah, my parents, So my mom has had endometriosis, and she had, I think, 2 cysts removed, if I'm right, and then she had to have her, one of her fallopian tubes, or part of it removed,
Okay.
and an ovary removed,
Okay.
and then, my dad has high blood pressure. My dad had what's it called? It's like when your insides start coming out, kind of.
Like a hernia?
Yeah, my dad had a hernia. Pretty sure my dad has anxiety,
Okay.
in my opinion.
Okay, how about your grandparents?
My maternal grandmother has depression. I think she has anxiety too, but I know she's diagnosed with depression. My paternal grandmother has depression and anxiety. My maternal grandfather is an alcoholic. Yeah.
How about your dad's dad?
My dad's dad.
Your grandpa?
Oh, he has what's it called? Prostate cancer.
Okay.
And my mom's dad also had that.
Okay.
And I think he has high blood pressure too. I don't really remember, but I think my dad's dad also has high blood pressure.
Okay.
Oh, and my dad's mom had like bypass surgery.
Okay, like cardiac or heart issues. Okay. All right, and now we are going to do a little bit more about your social history. So tell me what kind of occupation you're in right now.
Right now I'm a student. I'm a grad student, and I'm like transitioning to work. This summer I have a job, and I'm done with my degree. So I have a job this summer working as a camp counselor, basically.
Okay.
And then my goal is to by the fall have a teaching job.
Okay. Do you use any kind of tobacco or alcohol?
I don't use any substances.
No illicit drugs?
No.
Nothing that's illegal?
I've had alcohol a few times, but I don't like it, and I can't take it with my meds anyway.
Okay. What about caffeine use?
I drink some coffee, like when I visit my family, but it makes my anxiety worse, so I try to only do it like once in a while.
Okay. What about any kind of special diets that you're on?
I just have a normal diet.
Okay, regular diet. Have you ever been exposed to any infectious diseases that you're aware of?
Do you mean like HPV?
Yeah,
type
like
stuff?
like yeah, or sexually transmitted diseases, or kind of anything else that you feel was possibly infectious for you.
I think maybe just my grandma has cold sores.
Oh, okay. So some HPV.
So
maybe.
yeah, maybe some of that, but that's all that I know of.
Okay, but you've never had any cold sore outbreaks?
Mm-mm.
Okay. What kind of sexual partners do you normally have?
Only like long-term partners. So like I only have had sex with people who I'm like in a relationship with long-term.
And what is your partner preference?
I date women or people who aren't men that have like feminine bodies.
Okay. Okay. And you're not in a relationship right now?
No.
Okay. And what is your living situation?
I live by myself with my dog in an apartment.
Okay. What kind of a dog do you have?
A black Labrador Retriever.
Okay.
Her name is Lucy.
Okay. And I think you told me a little bit about your recreational activities. Already you did some skiing, some snowboarding, hiking, mountain biking, that kind of thing. And then I'm also wondering, do you use your bike helmet? Do you use your seatbelt?
I always wear my helmet. I always wear my seatbelt.
Okay.
If I go and I forgot my helmet, I just don't bike.
You just don't bike if you don't have your helmet. Okay. Now we are going to go into a little bit more review on your the body system. So there's gonna be a lot of questions. You can answer them yes or no. That might help us go through them a little quicker.
Okay.
Okay. The first one is, just generally, have you had any kind of fatigue or weakness at all? Have you noticed any weight changes?
Yes, fatigue, yes, weakness, no weight changes.
So yes to fatigue, no weakness, you haven't had any weakness, and you haven't noticed any weight changes, okay?
Or I have had weakness, but not weight changes.
Okay. Have you had any fever, chills, night sweats?
No.
Okay, any pain?
Just period cramps.
Okay.
So yes.
Okay, tell me a little bit about the fatigue. How often do you experience that? When do you experience it?
Typically every day, and I think it's connected to depression. So I just kind of feel tired most of the time.
Okay. When did that start for you?
In high school.
In high school. Okay. And then you have had periods where you felt that you have weakness, but you don't right now?
Yes.
Okay, tell me about that. When did that occur? How long did it last? And what kind of weakness did you feel in your body?
So it was tied to anxiety, and if I was nervous, if I was really nervous, I'd have to hold onto the wall to walk around because my legs were weak.
Okay.
Sometimes I'd have to crawl, or I'd have to have someone help me get home, drive me home, stuff like that.
Okay.
And that lasted from about when I was 17 up to when I was 18.
Okay, and did you ever get treated for that? Did you ever have diagnostic tests done for that?
I got treated for the mental health stuff, and then I also, to make sure it wasn't something wrong with my body, I did a whole bunch of neurological testing, and there was absolutely nothing abnormal.
Okay. So let's talk a little bit then about your anxiety and your depression that you've had. Do you have a provider that's treating you for that right now?
Yes.
Okay. And you said that this all started when you were 16? Okay. So now you're on medications and you feel that that's being well controlled for you?
Yes.
Okay. Do you have any current anxiety that you're feeling in situations that you have going on in just regular life events, or is there anything specific that you feel brings that anxiety on?
When I meet new people and I don't know if they'll respect my gender or not.
Okay.
When I'm in public places where people stare at me more, especially if I'm with other queer people and we get stared at more, that makes me nervous.
Okay.
When I'm around peers that I don't trust or that I feel make fun of me, then I get nervous. Any new environment makes me nervous.
Okay. So what do you do to handle that anxiety?
I try to ask, because sometimes I do the cognitive distortions where I make up stories with limited information, and I get upset and I don't even know if that's the reality.
Okay.
So I try to talk myself down with that.
Where did you learn those skills about talking yourself down?
In my therapy and in my weekly therapy, and then in the intensive outpatient programs I've done.
So you're currently under weekly therapy counselor?
Yeah.
How often do you go to that?
It's just once a week.
Is that just like a talk therapy, or is it a different kind of therapy? What kind of therapy is it?
It's talk therapy, and I think it's cognitive behavioral therapy specifically.
Okay. And then have you ever had group therapy or bigger treatments?
Yeah.
Okay, tell me about those occurrences.
2020, I was in day treatment where I went 5 days a week for 3 hours with a group.
Okay.
For 8 weeks.
Okay.
And then right after that, I went into a 3-day, 3 hours, 3 times a week DBT program with a group. And I did that for about 6 months. And then after that, I did individual therapy through everything.
Okay.
But after that, I continued my individual therapy, and then I entered a new DBT program once a week for 3 hours.
Okay.
In September, I think. Yes, in September, October about this year, and then I felt like I needed more, so then I got into another intensive outpatient program for day treatment, where I go every day, 3 hours a day for 5 days a week for 8 weeks. And now I'm just in once a week therapy.
Now you go once a week. Okay. So do you feel that treatment history and what you're doing right now, along with the medications, is meeting your anxiety and treating? Do you feel that you're being adequately treated for your anxiety and your depression right now?
I do. It's still affecting me every day, but it's compared to what it was, it is astronomically better.
Okay.
So
good. How has your mood been lately than like the last few weeks, with school coming to an end here and starting a new job?
I've been pretty depressed and anxious.
Okay. And what do you do to help with that?
I exercise, I visit my family, I talk to my parents or my siblings or my friends. I try to make sure I plan activities for myself so I'm not like ruminating in my apartment alone.
Okay. Okay. Those are all really good things. I'm just gonna ask you a little bit more, if you're trying to look a little bit deeper and make sure you're not missing anything. Do you have any issues with your memory that you're concerned about?
No.
Have you had any hallucinations?
Yeah, I'll hear things.
Are you currently hearing things?
Yeah.
What do you hear?
Birds, frogs, rain, crickets.
Okay. And when does that happen?
When I'm in the shower, when I'm just kind of any time really.
Do you hear it all day long?
It's
Just
like
specific
little
times?
maybe like 10 seconds at a time.
And is it intermittent throughout the day, or is it only at specific times during the day?
It's not specific on the times, but it's intermittent. It's not constant. And then it usually increases in like how loud it is and how long and how frequent depending on how stressed I am.
Okay, so you feel it's related to your stress. Is it bothering you right now, the hallucinations or the auditory
No.
hallucinations?
As long as they're not like all the time, it doesn't bother me.
Okay.
When I upped that medication dose and it was more frequently, that really freaked me out because then I didn't know what was real and what wasn't, and that was upsetting.
That got to be confusing.
Yeah.
Okay. Do you have any insomnia or problems with your sleep?
Sometimes I don't want to sleep because I feel scared to go to sleep and I don't really know why, but sometimes I just feel like it's not safe and I can't give a reason.
Okay. How do you handle that when that happens to you?
I'll like do another activity until I get tired.
Okay.
Or like if my thoughts are racing, I'll pray my rosary, or journal, and that usually helps.
Okay. Okay. So you're handling that okay? Then you eventually can get some sleep. Okay. You're not taking any medication for that. Okay. All right. And do you have any suicidal ideations, or do you have any obsessive compulsive thoughts that are occupying your mind?
Yeah.
Can you tell me, do you have any suicidal ideations?
Yeah, it's decreased a lot. Like, since I got my meds figured out, now it's just kind of like I'll think about it, but I don't want to do it as badly. Like, it's easier for me to see that that's not a good idea, if that makes sense.
How often do you think about suicidal ideations?
A couple times a week, maybe.
And is that more frequent or less frequent than normal for you?
It's less.
Okay. And you've never acted out on any of your impulses? Okay. Do you have any thoughts about hurting yourself? Okay, and that's the suicidal ideations.
They're different.
They're
That's
two
the
different things.
self-harm.
Okay, the self-harm. Tell me about the self-harm.
That's more frequent. That's kind of almost every day. I've never done, like I'll think about cutting, but I've never done it before.
Okay.
Instead of doing that, I'll exercise or I'll hold ice. That's my favorite one.
Okay.
Or the progressive muscle relaxation, or even just like lightly scratching, like for the sensation, that works too.
Okay, so you feel that you're handling that and you have a good system in place if that gets out of control.
Yeah, and if it's
Yeah.
really high, then I know, like, I call my mom or my sister or something like that.
Okay. Okay, so you have a good plan in place. Okay, that sums it up for the mental health right now. I'm going to just go through some different systems here. We're going to talk about your skin. So in general, have you noticed any lumps, rashes, itching anywhere? Any part of your body?
When I was sick a few weeks ago, I got these like red dots, like different sized blobs on my back and my chest and my neck, but they didn't itch. They were kind of dry, but it just was like, what is that? But it didn't discomfort me.
Okay, did it go away?
Yeah, it's almost gone now.
Okay, and that happened when you had an illness a couple weeks ago?
Some kind of virus, I think.
Virus, you think? Okay. All right. Did you use any kind of creams or any kind of gels for that on your skin? No? Okay. Have you noticed any changes in your hair, in your fingernails? Yes or no?
No.
Have you noticed any lumps or sores anywhere all over your body?
No.
Okay. Have you noticed any hair loss, thinning, or shedding anywhere?
No.
Okay. Have you noticed any change in your vision?
If I stop dissociating, things kind of look different.
Okay.
But I don't think it's an actual like vision problem.
Okay, have you had any double vision?
No.
Any blurred vision?
Only if I'm really freaking out.
Okay, from your anxiety. And then how long does that last?
Like, I don't know, from like a few seconds to like a few minutes.
Okay, and then your eyesight returns to normal after that?
Yeah.
Okay. And then do you have any floaters that you see? Any kind of halos or anything that you see? No. When was your last eye exam?
Last summer.
Okay, and that was all normal?
Yep.
Okay.
They just said my eyes were really, really dry, but
Just
everything
dry.
else was normal.
Okay. Okay. Have you had any ringing in your ears? Any dizziness?
Sometimes, yeah.
Tell me about that. Do you have which one? Ringing in your ears or dizziness?
Both.
You have both. How often does that happen?
Like half the days I wake up and I'm dizzy right when I wake up. I have to be kind of careful.
Okay. So how long does the dizziness last in the morning?
Only like a few seconds.
A few seconds? And then what, you just lay in bed until it goes away, or do you get up and walk around?
I get up. I like get up and I'm kind of like, ugh, and then I'm fine.
Okay. Okay. And do you have any, tell me about the ringing in your ears. When does that occur?
Usually at night.
Okay. And tell me how long does that last?
It's just kind of constant, and I notice it happens when I'm really anxious.
Okay. When anxious, you notice that. Okay, and that happens every night before you go to bed, are you saying?
No, just if I'm going through a period where I'm really anxious, then I'll have it at night.
Oh, okay.
Or sometimes throughout the day I'll notice it.
Okay. Is that bothersome to you?
No.
Okay. Okay. Have you noticed any kind of drainage in your ears at all?
No.
Okay, no imbalances throughout the day besides being a little dizzy in the morning?
No.
Okay. All right, so let's just go through the rest of your body here. Let's go through your nose. Have you had any kind of swelling in your nose, any kind of postnasal drip, any kind of nosebleeds, anything like that ever?
I'm getting over an illness, so my nose is kind of runny sometimes. but that's not normal.
Okay, and then what are you doing to alleviate those symptoms of the
I
runny
use
nose?
the neti pot.
Okay, you've been using the neti pot. You haven't had any fevers or chills?
I had some chills, but it's better now.
Okay, okay. Do you have any kind of sinus pain at all?
No,
Okay, and no cough?
I have a cough,
When does that occur?
just throughout the day a little bit.
On and off throughout the day? And is there any difficulty in breathing?
No.
Okay, so you don't feel short of breath?
No.
Okay. Is the cough progressively getting worse, getting better over the last few
Getting
days?
better.
Okay, and you think that might have been your virus, maybe? Okay. All right, we're gonna just talk about your mouth a little bit. Have you noticed any kind of bleeding in your gums?
No.
Okay. Any canker sores?
No.
Any hoarseness in your voice at all?
No.
With the coughing, hasn't bothered that? Okay. When you cough, or you don't bring up any phlegm or notice any product come up when you're coughing?
I feel it come up, but it's not enough to like
Okay. You're not
get out.
seeing anything that you spit up? No blood in your cough, no blood in your mucus, anything
No.
that's coming up? Okay. All right. Do you notice any kind of changes in tolerating hot or cold? Like when you're in your apartment, do you need like more blankets more often, or sometimes you don't want any blankets because you're too hot? Do you ever notice like any fluctuations in how you're feeling for your comfort?
I notice that when I'm depressed, I get cold more,
Okay.
and I get cold at night, and I have to wear like a sweatshirt,
Okay.
things like that.
Just like a little extra blanket, but throughout the day you don't feel like you need to wear. What do you feel like during the day?
Probably normal during the day.
Okay. Any changes in the texture of your skin at all? Any dryness or scaliness? No.
No.
Okay. And do you feel like you sweat more than other people or than average?
No, unless I'm nervous, then I sweat a little bit,
Okay.
but that's probably normal.
Do you notice any palpitations in your heart? Kind of, do you ever feel your heart racing?
Yeah,
Tell me when that happens.
when I'm really anxious.
You feel that
It'll
happens
be
when
like
you're
the whole day.
the whole day. How often do you feel those palpitations in your heart?
It just depends on what's going on if I'm really anxious about it. Since I took the clonidine, it's not really that frequent anymore.
Okay.
But if I am really amped up, then it'll come back.
Okay. And have you ever had an EKG or an ECG to check your heart?
Yeah, and it was normal.
That's all normal? Okay. All right. Okay, and you don't wear any glasses, so you haven't
No.
had any problems with your eyesight like you told me before. We talked about your coughing already. How about your breasts? We'll just kind of move down the body here. Have you ever noticed any discharge from your nipples, any lumps anywhere on your breast, any soreness or tenderness in your breast area, either side?
Before my period, it gets sore, but that's all.
Okay, so just a little bit before you get your period, some soreness. Okay. And you've been to the doctor, like you get your breast examined?
I've never had that done.
Okay. Breast exam. Okay. Have you noticed any pain or swelling in your arms or legs?
I noticed pain up my calf. I think it's from my ankle being sprained before.
Okay, you sprained your ankle. When did that happen?
Not this last winter, but the winter before.
Okay, so 2 winters ago,
Yeah.
you sprained your ankle and you still have pain in your calf from that? 2 years later. So you sprained your ankle in 2021?
The winter of 2021.
Yeah. 2021. Have you ever had that checked out?
Yeah, I did PT for it.
You did physical therapy? Okay.
Are we gonna have a problem down here?
Kevin, we're recording.
Okay.
Excuse me.
Is that pain, which side is the
My
pain?
left.
On your left? Is that the same side you sprained your ankle on? Okay. And how often do you have pain on your left calf?
Mostly every day.
Every day you have pain? On a scale of 0 to 10, where's the pain level at?
Like a 3.
0 being no pain, 10 being the worst. You're a 3 out of 10?
Yeah.
Does that pain occur? Tell me more. When does it happen? Is it intermittent? Is it continuous? What?
It's continuous, and then it gets worse if I am stressed. It gets worse if I'm standing a lot and not really moving around.
Do you take anything to alleviate that pain?
No, but I'm doing the stretches and the exercises, and that has been helping.
Okay. Stretches and exercises. Okay. All right. And then we move on to your gastrourinary and gastrointestinal systems here. Have you had any issues with your stools?
No.
Or with your bowel movements? You've never had any issues or concerns with that? Okay. Have you ever had any problems or difficulty passing urine?
No.
No. Okay. And then our last area I want to just ask you about is if you've noticed, any increase in headaches or any headaches at all.
I get headaches if I don't drink enough water.
Okay. And otherwise, no other headaches.
Yeah.
If you drink enough water, then those don't bother you.
Mm-hmm.
Okay. Any fainting spells?
Nope.
Any tremors?
Nope.
And you told me you had weakness history, but have you had any weakness recently?
In the last month, yeah.
Okay, tell me about that. When did that happen?
I was at school, student teaching, and then it was when I didn't take my meds for 4 days, and then I just kind of felt like something really bad was going to happen, and I couldn't tell what, but I just had that feeling, and then I felt like I couldn't really walk around.
Okay. So are you normally taking your medications every day?
Yeah.
You're really good. And then
Now I
that was just a one.
Yeah, because I kept forgetting to go to the pharmacy. After work, and the pharmacy closes at 4:30. So.
Okay, so you weren't able to take your medications because of the pharmacy's hours, and you didn't have any ahead of time. Okay. All right. And you don't have any history of any seizures?
Nope.
Nothing like that. Okay. I don't think I have any more questions for you. Do you have any questions about any of your body systems that you want to add to our interview here?
No.
Okay. Thank you for your time.